Hello, my name is Sylvia Metzler. I'm a family nurse practitioner. I've been a registered nurse for about 52 years. I've been a nurse practitioner for about 26 years. I'm 72 years old and I still work. I'm working at three different jobs, three part-time jobs. And I want to tell you a little bit about them. Starting this morning, I worked at Covenant House, which is a family practice in Germantown. And most of my patients are African American. Some have medical assistance, some have private insurance, and many don't have any insurance. But even the people with insurance, whether it be private or medical assistance or Medicare, often we have trouble getting referrals for people. And when I hear complaints about, oh, well, we don't want a system like Canada's because you have to wait, there's queues and there's lines, I get so upset and angry because my patients wait right here in the United States. Sometimes it takes me months before I can get them to see a cardiologist or a gastroenterologist or a dermatologist. So we have waits too, even with our insurance companies here. And then the really heartbreaking things are the patients that don't have insurance. Now, sometimes we can get them into the city health centers, but many people don't want to go because they say we have to wait, it's so long, we sit and wait for hours and it's so hard to get an appointment. So they'll come to our center and we'll try to see people on a sliding scale. But today I had a woman whose blood sugar was about 450, which is very high, just borderline of having to go to the hospital. And she's supposed to be on insulin and she can't afford it. And even though she has health insurance, they don't give her medications with her health insurance. And her husband lost his job, they can't afford it. So here she is diabetic and can't afford her insulin. And the woman could die. And this is just outrageous that people have to suffer like that. This afternoon I worked at Congresso, which is a program also in North Philadelphia for mostly Latino patients. Many of my patients don't speak English. I do speak Spanish, but it's really hard to find nurses and nurse practitioners who, number one, will work in North Philadelphia. Many of them are afraid, or even if they're not afraid, their husbands or partners don't want them working there. And then, in addition, in a place like Congresso, we really need to speak Spanish to be able to communicate with our patients. So I'm saying that to say it's very hard to find healthcare providers to work in many of these centers. And many of them can't afford to pay that much either, so that's also a disincentive for people to work there. We have a grant from the Family Planning Council, so we can see patients who are uninsured, which is really a big help. However, if they run into a problem, for instance, they have an abnormal pap test and they need a colpo or they need surgery on their cervix, it's very hard to get funding for that. We did have some, but with all the cutbacks in our economy, they've told us now we can't send people for colpos unless they really have very severe problems with their cervix, which means other people could have advancing cancer and not be treated. And this is just a worry to me all the time. And then in addition, at Congresso, many of our patients are here undocumented. They've crossed the Rio Grande and risked their lives to get here, trying to earn some money to send back to their families. And if they run into problems, we're really up a creek because there just isn't funding for them. Now tonight, my third job on Thursday, I work at the Catholic Worker Free Clinic in North Philadelphia. And there we take care of homeless people, people with mental illnesses, people with addictions that nobody else wants to take care of. But we're limited. We can just do so much. And if what they need is something simple, we can take care of it. But if it's more complicated, then we try to get them insurance, and we can't always do that, or we try to get them to a city health center. So even though myself personally, I have Medicare and it's an adequate policy and I'm pretty healthy, there's not a day that goes by that I don't see patients who are having problems. And I just want to say we need Medicare for everybody. We need a single-payer healthcare system. The bill that President Obama is working for in Washington, some of the things are better than nothing, not being allowed to deny people for pre-existing conditions, but there's many parts of it that really aren't that good. It's not covering everybody. People are still going to have expensive premiums that they can't afford. So I have been working for years for Healthcare for All Philadelphia. It's an organization that you saw tonight in the presentation about the survey. Well, the group I work with, we're the ones that got that survey on the ballot and worked hard for about 2 years to get it passed. So that was really encouraging, and I think it's wonderful that Philadelphia is trying to provide more safety nets. There's also a bill in Pennsylvania to provide universal single-payer health care, which we should all get behind. And in Washington, I have mixed feelings about the bills that are there. In some ways they're better than nothing, but in some ways they're not, and we need a universal single-payer healthcare system. I believe that for the last 30 years, and every day of my life I believe it more strongly. Thank you.